Are you constantly doing neck stretches but still dealing with tightness, cervicogenic headaches, maybe cervicogenic dizziness, or neck pain? You're not alone, and there's a good reason why constantly stretching your neck does not give long-term relief. Let's dive into the science on why stretching your neck could do more harm than good, and most importantly, let's look at what you should be doing to get relief. Well, welcome back to another episode of Physio Tips with Mauro. I'm your host, Mauro Burnett. For those of you that don't know me, I'm a board-certified orthopedic specialist in physical therapy, postgraduate physical therapy educator, and the owner of Australian Physiotherapy Specialist, located here in Jacksonville, Florida. If you ever need PT and you're in this area, check us out, www.australianpt.com. Okay, let's talk about today's video. Over my 24-year career, I can't believe it's 24 years already, I've treated thousands and thousands of patients that have had cervicogenic headaches, cervicogenic dizziness, and neck pain. One of the hottest things on the internet right now, if you're suffering neck pain and you're looking for advice, you're going to find tons of info on neck stretches. And you're going to find great tutorials on how to do these neck stretches. However, let's talk about the efficacy of stretching your neck for neck disorders like cervicogenic headaches or cervicogenic dizziness. When you research what are the best things in science to do to help, stretching turns out to be the bottom of the barrel. Even if you did stretch your neck and you temporarily felt some relief by lengthening the muscles, here's the rub. It's not going to address the key issue of why your neck's tight to begin with, right? The neck is tight usually because your body is trying to protect itself. If there's a behind-the-scenes weakness in the neck or instability, your outer muscles overcompensate to try to hold the head up against gravity. This can be caused from poor posture over a long period of time, an injury like sports or car accident. But over time, if you've had neck pain, it's going to cause weakness of your deep stabilizing muscles. Your body then overcompensates by tightening the large neck muscles. So here's the science. Muscles in your neck become tight due to your body is protecting itself because there's an underlying instability, or an overuse or imbalance in your muscle system. One muscle's gotten weaker, the other muscle's overcompensating. But stretching doesn't fix either one of these issues. Stretching isn't going to fix your strength loss, stretching's not going to improve your posture, and stretching's not going to help correct that underlying instability. So we're going to take a look at some of the best exercises that I've shown in the past that can really help decrease neck pain, neck tightness. They've been clinically shown to help cervicogenic headaches, headaches that come from pain in the base of the head, and cervicogenic dizziness, dizziness that stems from pain in the neck. Let's dive into some of these exercises and take a look. This is a research-proven exercise to help decrease neck pain and neck pain-related headaches, etc. It's an exercise that's going to address that massive strength loss through the deep neck flexors. We mentioned earlier, the one study had 50 to 75% strength loss. So this is kind of how it goes. I want a little bit of a folded towel square. I want to make sure that my chin and forehead are level. If your spine is totally straight, you may not need a lot of toweling, but for me, I need a little bit of toweling to get straight. So this is what we're going to do. My hand is going to rest on the front neck muscles. These are my superficial muscles, and I want to make sure that they're not engaged during this exercise. So I look down with my eyes at a point on the ceiling just above my knees. And then I gently nod my chin forward, very slow, very precise, making sure that I don't tighten these superficial muscles. Once I reach that point, I'm still looking down. I hold that for 10 seconds. At the end of 10 seconds, I look up towards the ceiling right above me, and then I slowly come back and relax. And that would be rep 1. You could repeat this 10, 12 times, and this can easily be a twice-a-day exercise. It's important that it doesn't cause pain in the back of the neck. It's also important that we're not lifting. Lifting is the #1 error that people make. It's also not a McKenzie chin retraction. I'm not pushing back. It's a look down, point on the ceiling above my knees, nod very smoothly, very gently. Make sure the muscles don't get tight. If they start getting tight, then back off just a little bit. Hold it for 10 seconds. Then relax back to this point right above here. And that's going to be a great deep neck flexor exercise. Give it a try. If it goes well with you, put it in your routine. For this exercise, we're going to address weakness in the middle and lower trapezius muscles. This is something that's found commonly when you're having neck pain or cervicogenic headaches. So here's how the exercise works. You lie down in your bed, lie on your side, get one of your pillows that you love to sleep on that make you comfortable lying on your side. Then you stack up 2 or 3 pillows in front of you and you stretch your arm over those pillows, kind of like a body pillow, right? You're going to have your arm not just 90 degrees, but you're going to have your arm angled up, maybe like 130 degrees. From that position, you're going to draw your arm back and down over your chest wall towards the center of your spine. You hold that position for 10 seconds, and then gently return to your starting position. Gently draw your shoulder blade back and down, going over your back towards the center. Hold that for 6 to 10 seconds and relax. Try to build up to where you could do 10 or 12 reps. And this could easily be a twice-a-day exercise. For our second exercise, we're going to look at a postural correction exercise. This exercise is crucial. We can do all these great techniques. You can go to therapy and get all these great things done to you and feel better. But if you're sitting with bad posture, your back slouched, your chin's poking forward, guess what? That's going to bring that suboccipital tightness back, and here comes your occipital neuralgia and your cervical dizziness all over again. So this exercise, maybe it's not as flashy, but it's super important. I'm going to use Lily here as we demonstrate this. So Lily's kind of sitting up nice and tall. I like this. But let's say she's an office worker. Maybe that would be breaking some labor laws at your age at 11. But let's try slumping a little bit, and your head kind of comes forward. Right. With her head coming forward and her slumped, guess what? These suboccipital muscles, they're going to get tight right away. So this is what we're going to do. I want you to go tall with your lower back. There you go. Come out of that slumped posture. Bring your chin just slightly back in. There you go. That's perfect. Now her ear's over her shoulder's over her hip. And that's going to take stress off those suboccipital muscles. So this is what I would tell her to do. You hold that for about 10 seconds. And then if you're an office worker, 3 or 4 times an hour, maybe like every 15 minutes, stop what you're doing, set your phone to remind you, get into this posture. It's going to take stress off of your sore joints, and it's going to stimulate those good stabilizing muscles to work. Let's have you turn sideways a little bit, Lily, and we'll show you from this angle. There we go. So we're going to slouch a little bit, bring that head forward. There you go. At this angle, those suboccipital muscles, they're going to get so tight. So tall here, nice and tall. Great. Bring this back down. Perfect. It's not a bad idea, maybe once or twice a day. Try this 4 or 5 times just to practice getting into this neutral low back posture. You don't want to be all the way hyperextended, but you definitely don't want to be slouched. You want to grow tall, find that nice position. What do you think? Does that feel a little bit better?
Yes.
All right. Well, there you go. Neck stretches may feel good in the moment, but they're not giving you the long-term solution that your neck needs. Instead, focus in on improving your strength of your neck and shoulder girdle, improve your posture. Let's treat the underlying cause of the tightness, and your body will thank you for it. Well, thanks for tuning in for today's video. Don't forget to like, subscribe, and share this video with a friend that might be suffering neck pain, headaches, or dizziness. Goodbye for now, and we're going to see you next time on Physio Tips with Mauro.